Meet Mr. Johnson. He's living with Parkinson's disease and the symptoms that go along with it. He's scheduled to take another dose of the medication in a half hour. The problem is that his last dose may be wearing off, causing his symptoms to be more pronounced. This period is called an off episode. In this presentation, you'll learn about off episodes, how to recognize the symptoms, and keep your residents safe when one occurs. So, let's start by answering the question, what is an off episode? It's a period when the drug levodopa, taken by a person with Parkinson's, wears off. Basically, it stops working before the next dose is taken. An off episode can last for a few minutes or up to a few hours, multiple times a day. When this happens, a Parkinson's individual won't feel like their usual self. They may have more tremors and slowness or stiffness, which can cause difficulty moving or walking. An off episode can also affect emotions and anxiety levels as well. As a caregiver, it's a good idea to ask your resident, what does an off episode look like for you prior to one occurring? Give them time to explain how it affects them. With this information, you'll come to notice off episodes throughout the day, such as when you're helping them get out of bed or assisting them with dressing in the morning. Here's a common scenario. In your effort to complete all of your morning responsibilities, you enter Mr. Johnson's room and tell him to wake up.
Get up.
It's time to get out of bed, but he just makes some sounds and doesn't move.
All right, you're not going to work with me today?
As your frustration level increases, so does the tone of your voice. Understandably, you know this is going to put you behind with all of your other residents. Unfortunately, you may not be aware that Mr. Johnson is in an off episode due to the wearing off of his last dose of levodopa. Combine that with Mr. Johnson feeling anxiety about being rushed, he may experience a freeze even while lying in bed. Here's a solution when faced with this type of situation. Don't walk into a resident's room first thing in the morning and say, "Let's get out of bed."
Good morning, Mr. Johnson. Gonna be a great day.
Wake him up first and say, "I'm going to be back in an hour," and get you out of bed. By doing this, you're preparing him for what will come next. Then, take care of others who don't need the prep. Parkinson's residents need more time to do the things you're asking of them. They're not being difficult or non-compliant. Due to their disease, it just takes them longer to do things and they need time for the medication to start working. A common occurrence during an off episode is known as gait freeze, or the feeling of being stuck in place when attempting to walk. It can happen suddenly. Literally, in an instant, a person's feet will not move forward despite the intention in their mind to walk. These episodes can be frustrating, annoying, and perhaps embarrassing, and can become incredibly disabling and lead to injury. Keeping your residents safe is the primary job of a caregiver. That said, it doesn't mean your residents should stay in a wheelchair all day. The phrase, "use it or lose it," applies to Parkinson's residents. You can always consult a physical therapist on how to handle gait freezes in order to keep your Parkinson's residents safe while doing some much-needed walking. When a Parkinson's resident first starts walking, makes a turn around a corner, or has to navigate near obstacles such as chairs or tables, any of these situations can cause a person to get stuck. So what do you do when it happens? Remind them not to fight the freeze by trying harder to step forward. Ask them to settle back down onto their entire foot. Start shifting their weight from side to side. Then suggest they walk forward. Here are some other techniques to help them in that moment. Shift their attention from moving their legs to raising an arm or touching their head, and then resume walking forward. Visualize an object on the ground in front of them and try to step over it. March in place a few times and then step forward. Take a breath, stand tall, and start again, focusing on making that first step a big step. Remember, don't count on a solution that worked yesterday to work today. Also, tell the resident's neurologist and physical therapist that it's happening so they can provide information on how to get unstuck and better manage freezing of gait episodes. If a therapist or doctor recommends the use of a cane or walker, make sure your resident uses it. Don't let them rely on reaching for walls or furniture to walk. Walking through tight spaces or crossing thresholds can be difficult and cause anxiety for persons living with Parkinson's, resulting in a freezing episode. If there is an exit sign down the hall, tell them to look through the doorway at it or some other point of reference further away, then walk toward it. Not one strategy will work every time, but many Parkinson's residents respond well to music. Using sound cues can sometimes help during a freeze. Have the resident sing a song, create a rhythm by tapping their hand on their leg, or carry a small metronome to get them walking. People with Parkinson's are 2 times as likely to fall compared to the general older population. Once falls begin, they are likely to continue. Falls lead to injuries, fractures, pain, and fear of falling. Transferring a Parkinson's resident from the bed into a chair or from a chair to a walker requires your awareness in order to avoid injury both to you and your resident. People with Parkinson's have balance issues, and when they are standing or walking, stay close to them. If Mr. Johnson is sitting in a chair but wants to stand up, coach him through the process. Tell him to scooch to the front of the seat. If he is having difficulty scooting forward, you can assist him with cueing his hips forward with your hand. Many times, less verbal instruction is better as it limits confusion and frustration. Then, direct him to put his feet on the floor a comfortable distance apart. It is very important to make sure to get his weight over the ball of his foot, making it easier for him and you as well. If he uses a walker, it should be right in front of him. If needed, place a hand on his back, applying slight pressure forward versus up. This is critical in helping to achieve a stand. The classic nose over toes is a good verbal cue to assist in shifting his weight forward. Have him push off from the seat or the armrests of the chair, not the walker. Encourage him to stand slowly to avoid something called orthostatic hypotension, a form of low blood pressure. Remind him to stand tall and take his time. Ask Mr. Johnson if he feels okay before he takes that first step. Also, have your Parkinson's resident drink 8 ounces of water within 15 minutes of taking medicine to avoid dehydration. Encourage them to continue drinking water throughout the day. Dehydration makes Parkinson's symptoms such as dizziness, confusion, and coordination worse. Off episodes are stressful for residents. There are multiple strategies available to reduce their anxiety. Visualization is a powerful technique used by athletes to improve performance. It can work just as well for people with Parkinson's. Have them picture an event that causes anxiety, such as walking through a doorway. Then ask them to think of that again, but this time, see themselves walking through that threshold. Navigating through off episodes can be challenging. But with these techniques and the help of doctors and therapists, focus on providing the best possible care in order to keep your Parkinson's residents safe.